Another week of GLP One headlines. One day the news is telling us of these drugs as miracle heart savers. The next day they're silently weakening our bones. As a guy in his 50s who grew up on Snackwells and Olestra, I've learned to take flashy headlines about what's healthy with a grain of salt. In this roundup, I'll unpack the latest stories on GLP-1 medications, highlight what research really shows, and maybe make a few sarcastic remarks along the way. For this weekend wrap-up, we've got 4 quick stories to cover. First, a study raising concerns about osteoporosis and gout, the so-called silent health issue. Second, new rodent data suggesting GLP-1s might help the heart heal after a heart attack. Third, Eli Lilly's Employer Connect plan for Zepbound and why names like GoodRx, Mark Cuban's Cost Plus Drugs, and Teladoc are getting involved. And fourth, conflicting reports on whether the pounds come back when you stop taking these medicines. Remember, this is information, not medical advice. I'm just sharing my own research and experience as someone on this weight loss journey. Always talk to your doctor about what's right for you. If you like staying informed without the hype, hit the subscribe button so you don't miss the next update. Let's jump right in. The first headline, silent bone and gout risks. A study presented at a meeting by the American Academy of Orthopedic Surgeons looked at medical records from about 146,000 adults with obesity and type 2 diabetes. Researchers compared people taking GLP-1s, Semaglutide and Liraglutide, that's Wegovy, Ozempic, Victoza, and Saxenda, to those not taking them. Roughly 4% of GLP-1 users were diagnosed with osteoporosis versus just over 3% of non-users, about a 30% relative increase. Bone softening is rare, but occurred about twice as often in GLP-1 users, and gout rates were slightly higher as well. The lead author, Dr. John Horneff, said the team started looking at bone health after seeing tendon tears in patients who weren't eating enough. He likened the bone changes to what happens to astronauts. Less weight on your bones can mean less stimulation for bone growth. However, the researchers were clear this doesn't prove GLP-1s cause this. They also didn't have any data on the patient's diets, exercise, or vitamin intake. So here's my take. Losing significant weight quickly does reduce the load on our skeleton, and while that is happening, we often eat less overall. That means we might also skimp on calcium or vitamin D. We all hear about Ozempic side effects like nausea or stomach cramps. Bone health doesn't always make the list, but it's worth watching. This study signals that clinicians should monitor bone health, especially in people prone to osteoporosis or gout. Remember, though, that the absolute numbers were tiny, about 4% of GLP-1 users versus just over 3% of non-users. That's roughly one extra person out of every 100. A 30% relative bump sounds big, but the baseline risk is low, so the 1% gap is almost noise. It doesn't mean GLP-1s are suddenly dangerous, but it does remind us to keep getting enough balanced nutrients. Think of your bones like the frame of a classic car. Just because you're driving lighter doesn't mean you can ignore the rust. So the next headline, GLP-1s helping hearts relax. On the brighter side, researchers published an animal study in Nature Communications showing that GLP-1s might help with heart attack recovery. When arteries are cleared after a heart attack, they sometimes stay tightly constricted in a phenomenon called no reflow. In rodents, injecting Exendin-4, which is a GLP-1 mimic, this made tiny capillaries relax back to normal. The scientists proposed that drugs like Semaglutide or Tirzepatide could be repurposed to prevent no reflow and improve heart attack outcomes. The mechanism is fascinating. When the brain senses blocked blood flow, it triggers the gut to release GLP-1, which then binds to parasites. Not parasites like your mother-in-law. Pericytes are the cells around blood vessels, causing them to relax. It's a brain-gut-heart connection that hints at why GLP-1 drugs already reduce heart attack risks in people with obesity and diabetes. So my take here is this is early work in rodents, not a call to start injecting GLP-1 after heart attacks, but it does illustrate that these drugs influence more than just appetite. It's like discovering that your favorite multi-tool can actually fix a leak, not just tighten screws. Stay tuned as clinical trials explore whether the same effect occurs in humans. The next story, Lilly's employer plan for Zepbound. Eli Lilly rolled out a new Employer Connect program this week to help companies offer the GLP-1 drug Zepbound to employees. Under the plan, a Zepbound quick pen delivering 4 weekly injections costs about $449 per month across all doses. In other videos on the channel, I've actually covered the Lilly self-pay program, and different strengths have different prices. The idea here is that employers can use cost-sharing arrangements and bundled services like diet coaching or pharmacy networks to lower employees' out-of-pocket costs. So connecting employers with third-party program administrators could widen access. They've enlisted partners you probably already recognize, GoodRx, Mark Cuban's Cost Drug Plus, and Teladoc, to bring some name-brand credibility to the program. My take here, for years, GLP-1 drugs felt like Ferraris. Great if you could afford them, but out of the reach for most of us. With all the buzz around Zepbound and weight loss and Tirzepatide, Lilly's plan is like a car share program. You still pay, but costs get split, and you might get some driving lessons thrown in. It's great news for folks whose employers sign up. For everyone else, it shows how much business is scrambling to keep up with the demand on our collective weight loss journey. The next one here is, do the pounds come back? 2 conflicting takes. So Science Daily's cautionary view, a British medical journal meta-analysis reviewed 37 studies involving a little over 9,300 participants who took prescription weight loss drugs, including GLP-1s, for about 39 weeks and were followed for roughly 32 weeks after stopping. People who quit the medication regained just under a pound a month on average, and researchers estimated that the body weight would return to pre-treatment levels within 1.7 years, or 1 year, 9 months. Things like your cholesterol, blood pressure, they estimated those bounced back after about 1.5 years. Weight regained after drug-induced loss occurred almost 4 times faster than weight regained after diet and exercise alone-based weight loss. Only 8 of the included 37 studies evaluated newer GLP-1 drugs like Zepbound, and none of these followed patients for more than 12 months after stopping. In another article, however, Reuters has a more optimistic view. An analysis of real-world health records on more than 135,000 patients suggested that many people keep the pounds off after stopping Semaglutide or Tirzepatide. In their sample, roughly 1/3 maintained or even continued losing weight, and about 1/3 regained what they lost, with the remainder falling somewhere in between. That 1/3 split is the kind of soundbite you can take to your doctor when discussing whether to stay on the meds. The researchers admit the data is observational and doesn't fully account for lifestyle factors. Still, they see a glimmer of hope. With the right habits and guidance, some of us might step off the GLP-1 treadmill and still stick to our weight loss journey. So, reconciling the contrast. The BMJ meta-analysis mainly analyzed older drugs and short follow-ups, so it might underestimate the durability with that of newer GLP-1s. The study reported in Reuters draws on real-world data, but it isn't peer-reviewed and may be biased by confounding factors like exercise and diet. Together, the articles tell us that some people regain weight quickly, while others keep it off. The takeaway? Weight management isn't a one-size-fits-all story. Think of it like tuning a radio. Some stations come in loud and clear, others fade when the signal stops. Your job is to find the frequency that keeps you tapping your foot and singing along. So here's the wrap-up and what we learned this week. Bone health matters. Rapid weight loss and low nutrient intake may raise the risk of osteoporosis and gout, but the absolute risk is still low. Eat your calcium, lift some weights, and talk to your doctor about monitoring bone density. The heart benefits continue to emerge. In mice, GLP-1s help blood vessels relax after heart attacks, hinting at potential new use beyond weight loss. Access is evolving. Employers are being courted by drug makers. Programs like Lilly's Employer Connect aim to make GLP-1s more affordable. And long-term weight control is complex. One analysis warns that weight and health markers rebound within 2 years, and that the regain happens almost 4 times faster than diet and exercise weight loss alone. But in the same week, another study suggests many patients keep the weight off, with roughly 1/3 maintaining or continuing to lose, and another third regaining. Both stress the importance of diet and exercise. At the end of the day, GLP-1 medications are tools, powerful, sometimes life-changing tools, but they aren't magic wands. Use them wisely, watch your nutrition, and stay active. Whether you're on Mounjaro, Zepbound, or a compounded version, or any other GLP-1, remember, your weight loss journey is your own. If you've noticed changes in your bone health, or if you've stopped a GLP-1 and kept the weight off, or not, share your experiences in the comments. Hit subscribe so we can keep exploring this journey together. After all, it's not just about the weight, it's about the rewrite. See you soon.